Elderly, pay close attention. According to data from the World Health Organization, more than 55 million people worldwide currently live with some form of dementia, and nearly 10 million new cases are diagnosed each year. Among the leading causes is a deficiency of essential nutrients for the brain, and one of them is vitamin B12. I am Dr. William Tharnell, a physician specializing in elderly health, with over 25 years of experience in geriatrics and integrative medicine. Throughout my career, I have followed thousands of patients who faced memory lapses, constant forgetfulness, and that feeling that the mind no longer keeps up with the body. What few know is that there is a simple, affordable, and safe solution to help slow this process and keep your memory active for many years. In this video, I will show you, step by step, how to prepare an affordable homemade B12 supplement, backed by international studies, that can completely change how you view your daily life. But before we continue, do the following. Like this video so more people receive this vital information. Share it with your children, grandchildren, or friends who also need to take care of their memory. And comment below if you or someone you know has suffered from constant forgetfulness. Your participation could save lives. Get ready, because what you'll learn today could be the first step toward protecting your brain and ensuring a better quality of life. Imagine waking up one day and not remembering where you put your keys or forgetting the name of a beloved grandchild. For many, this seems like just part of aging. But the truth is that frequent forgetfulness can be the first sign of something much more serious. According to global studies published by Alzheimer's Disease International, over 50% of dementia cases worldwide could be delayed or prevented if nutritional and metabolic factors were treated in time. This means that every year, millions of elderly people are losing their memory due to avoidable reasons, such as a simple vitamin B12 deficiency. The problem is that this loss doesn't happen overnight. It is silent, sneaky. First, you forget an appointment, then a name, then you start having trouble following a conversation. And before you know it, simple tasks like making coffee or paying a bill become confusing. I've treated patients like George, a 68-year-old man who said, "Doctor, I thought forgetting was normal until the day I couldn't remember the way back home." This kind of story is more common than you might think. And here's the warning: don't wait for forgetfulness to worsen. Memory isn't like a machine that just wears out over time. It needs nutrients, care, and the right stimulation to keep functioning. In the next sections, I'll explain exactly what role vitamin B12 plays in this story, how it works in the brain, and, most importantly, how you can get it in a simple and affordable way to protect your mind. Now that you understand the seriousness of the problem, let's talk about a crucial detail: vitamin B12. Few people know this, but B12 is like a special fuel for nerve cells. Without it, neurons start functioning slowly and disorganized, directly affecting memory, concentration, and even physical balance. B12 is involved in the formation of myelin, a protective sheath that covers the nerves and ensures information travels quickly and accurately throughout the body. When this vitamin is lacking, electrical impulses become compromised, as if the wire were stripped and the message didn't reach the brain intact. Studies published in the Journal of the American Geriatric Society show that elderly people with adequate levels of vitamin B12 have up to a 30% lower risk of developing cognitive decline. That's why doctors worldwide, including myself, emphasize its importance in daily life. And here's an important point: we're not just talking about memory. A lack of B12 can also cause tingling in the hands and feet, extreme fatigue, dizziness, and even mood changes. All because the brain and nerves depend on this nutrient to function well. If you or someone you love has been experiencing frequent forgetfulness, it's time to pay close attention. In the next few minutes, you'll learn how to identify the symptoms of this deficiency before it leads to more serious consequences. Many people live for years with low levels of vitamin B12 and don't even realize it. The signs appear slowly and, because they're subtle, are often attributed to normal aging. But this is a mistake that can cost dearly. The initial symptoms are usually simple: frequent forgetfulness, like not remembering where you placed objects or daily appointments. A constant feeling of tiredness, even after a good night's sleep. Tingling or numbness in the hands and feet, which may seem temporary. difficulty concentrating or following longer conversations. Over time, if the deficiency isn't corrected, these signs progress to more serious problems. Difficulty balancing while walking, increasing the risk of falls. Mood changes, like irritability or sadness for no apparent reason. Mental confusion, episodes of disorientation, and even symptoms resembling early dementia. One of my patients, Robert, 72, came to my office saying, "Doctor, I'm just getting old, I can't remember anything anymore." After simple tests, we discovered he had a significant B12 deficiency. After proper treatment, he returned to driving, playing cards with friends, and remembering family birthdays. These signs should not be ignored. If you identify with any of them, know that there are simple ways to correct the deficiency and protect your memory. And I'll show you exactly how to do it, starting with real stories of people who've already turned things around. To help you better understand the impact vitamin B12 can have, I want to share 2 stories that marked my career. The first is about Mary, a 69-year-old grandmother of 4. She began noticing she was forgetting important appointments, like medical visits and birthdays. Mary told me emotionally, "Doctor, I don't feel like myself anymore. I'm afraid I won't be able to take care of my family." After a detailed evaluation, we identified a B12 deficiency. She started a simple routine with supplementation and dietary adjustments. Within a few months, she returned to her church choir and remembered every detail of the stories she told her grandchildren. The second case is John, a 74-year-old man who volunteered at a local library. He came to me because he could no longer remember the names of the books he recommended to people. John believed he was entering an irreversible process of dementia. But once again, tests showed a B12 deficiency. With an affordable and proper treatment, he regained mental clarity. Today he proudly says, "My mind is sharper than ever. I've gone back to helping people with joy." These stories are living proof that you don't have to accept forgetfulness as a normal part of aging. There are simple, affordable, and extremely effective ways to restore your brain's vitality. And to understand why so many elderly people, like Mary and John, end up suffering from this problem, we need to look at the reasons that increase the risk of B12 deficiency in this stage of life. That's what we'll cover next. As we age, our bodies undergo natural changes that directly affect how we absorb nutrients. Vitamin B12 is one of the most critical examples. Even if you eat foods rich in it, like eggs, meat, and dairy, your body may not absorb it as it should. One of the main reasons is reduced stomach acid. After 60, the stomach produces less hydrochloric acid, which is essential for separating B12 from food and allowing it to be absorbed in the intestines. Without this process, the vitamin simply passes through the body unused. Another common factor is continuous medication use. Drugs for gastritis, diabetes, or hypertension, commonly taken by the elderly, can interfere with B12 absorption. Many patients, like Helen, 67, had no idea that their daily stomach medication was contributing to forgetfulness and lack of energy. Additionally, restrictive diets or low intake of animal proteins also increase the risk. Elderly people who eat little or follow very limited diets may suffer from a lack of this vitamin without realizing it. That's why even those who maintain what's considered a healthy diet can develop a deficiency. It's crucial to be aware of the signs and, if necessary, seek alternative ways to ensure adequate B12 intake. And if you're wondering, is there an affordable way to replenish this without spending a lot? The answer is yes. In the next section, we'll discuss the differences between expensive synthetic B12 and the affordable homemade version that can transform your mental health. Many people, upon discovering they have a B12 deficiency, rush to the pharmacy and are faced with endless options. Expensive injections, imported pills, and capsules promising miraculous results. But is all of this really necessary? The truth is that synthetic B12 sold in pharmacies tends to be costly and often comes in doses that don't fit well with the reality of an elderly person who needs continuous support, not occasional overload. Additionally, some of these products contain additives or concentrations that require frequent medical supervision, which may not be feasible for those seeking a simple, low-cost solution. On the other hand, There are ways to prepare a safe and affordable homemade B12 supplement using natural ingredients easily found in any grocery or health food store. This alternative doesn't replace medical treatment when needed but serves as a preventive and maintenance strategy for brain health. Here's an important detail. The homemade version isn't inferior in quality as long as it's made correctly and used responsibly. Many elderly people, like Edward, 70, have maintained adequate B12 levels with a guided homemade preparation, without spending large sums on pharmacy supplements. This not only saves money but also gives a sense of autonomy, that you're in control of your health. And the best part? It doesn't require advanced cooking skills, just attention to preparation. Next, I'll show you exactly how to prepare this homemade B12, with each step clearly explained so you can make it in your own kitchen, easily and safely. Now comes the moment many have been waiting for: how to prepare your homemade B12 in a practical and economical way. First, remember, this recipe is a natural supplement, ideal for maintenance and prevention. If you have a severe deficiency confirmed by tests, consult your doctor for specific treatment. Simple, easy-to-find ingredients. 1 cup of nutritional yeast fortified with B12, common in health food stores in the U.S. Half a cup of unsalted sunflower seeds. 1/4 cup of raw cashews. 1 teaspoon of turmeric powder, optional, but helps with antioxidant action. 1 teaspoon of Himalayan or sea salt, adjust to taste. Preparation. In a food processor or powerful blender, add the sunflower seeds and cashews. Blend until it forms a coarse flour. Add the nutritional yeast and blend again until well mixed. Add the salt and turmeric, and blend a bit more. Transfer the mixture to a tightly sealed glass jar and store in a cool, dry place. How to use daily. Sprinkle 1 tablespoon per day over soups, salads, cooked vegetables, or even scrambled eggs. The flavor resembles a mild Parmesan cheese, making food tasty and healthy at the same time. Many of my patients report that within weeks of daily use, they notice more energy, fewer memory lapses, and even improved mood. It's simple, cheap, and incredibly effective as nutritional support. Next, I'll explain how to use it correctly without overdoing it, so you can enjoy all the benefits without risks. When it comes to health, remember, more isn't always better. Vitamin B12 is essential, but it should be consumed in the right amount to avoid overloading the body and to ensure safe, sustainable use. The homemade mixture you just learned is designed to provide an adequate daily dose for maintenance. The practical recommendation is simple. Consume 1 tablespoon per day, sprinkled on food. Avoid exceeding this amount, even if you think it might speed up results. The body has a limit for daily B12 absorption, and excess simply won't be used. Another important tip: don't try to replace entire meals with this mixture. It should complement your diet, not be the foundation. Combine it with meals rich in lean protein, varied vegetables, and healthy fats like olive oil. And another warning: if you're already using injections or supplements prescribed by a doctor, don't stop treatment on your own. The homemade version helps with prevention and maintenance but doesn't replace treatment for severe cases or diagnosed deficiencies. By following these guidelines, you ensure your brain gets steady support without excess or risks. And to further enhance the effects of this vitamin, it's essential to also take care of your overall diet. That's what we'll discuss now. Vitamin B12 is crucial, but it's part of a bigger picture. For your brain to function at its best, you need to create an internal environment that supports it, with other nutrients that work alongside B12. Include more dark leafy greens in your meals. Spinach, kale, and broccoli are rich in folate, a nutrient that, along with B12, helps reduce homocysteine levels in the blood, protecting the brain's blood vessels. A study published in Neurology showed that elderly people with diets rich in folate and B12 had slower cognitive decline. Add fatty fish to your diet. Salmon, sardines, and mackerel are excellent sources of omega-3, an essential fat for neuron membrane health. In the U.S., the American Heart Association recommends eating fatty fish at least twice a week to improve brain function. Eat eggs in moderation. The yolk is rich in choline, a nutrient that contributes to the formation of memory-related neurotransmitters. It's an easy and accessible ally. Avoid ultra-processed foods. Ready-made meals, sodas, and processed meats increase inflammation in the body and hinder nutrient absorption. Opt for homemade meals whenever possible. Stay well hydrated. Even mild dehydration can cause mental confusion and memory lapses. Keep a glass of water nearby and drink throughout the day. These simple changes, combined with the correct use of homemade B12, create a solid foundation for keeping your memory active and protecting your brain. But there are still common mistakes I see daily in my practice, and you need to avoid them to ensure your efforts aren't wasted. Even with the best intentions to care for their health, many elderly people make simple mistakes that cancel out the benefits of vitamin B12. It's important to recognize these missteps to avoid falling into the same traps. Mistake 1. Storing the mixture incorrectly. Leaving the jar open, near the stove, or exposed to sunlight causes the mixture to lose quality. B12 is sensitive to heat and light. How to fix it? Always store it in a tightly sealed glass jar in a cool, dry place away from heat sources. Mistake 2. Using it sporadically. Using the mixture only once a week doesn't ensure adequate B12 levels. Replenishment must be constant to keep the brain nourished. How to fix it? Set a reminder or associate it with a daily meal, like breakfast or dinner. Mistake 3. Believing the mixture alone solves everything. B12 helps a lot, but it doesn't work miracles on its own. A poor diet and lack of mental activity remain harmful. How to fix it? Follow dietary tips, keep reading, engage in conversations, and challenge your brain daily. Mistake 4. Ignoring persistent symptoms. Even while using homemade B12, if you continue experiencing tingling, confusion, or severe forgetfulness, you should see a doctor. How to fix it? Schedule an appointment for evaluation and tests to rule out other underlying causes. Many elderly people, like Susan, 71, realized that correcting these simple mistakes led to much faster memory improvement. Now that you know what to avoid, let's address common questions about vitamin B12 and its use. Over the years treating elderly patients, I've noticed many recurring questions. Here are the most common ones, with clear answers so you can use B12 with confidence. Question 1. Can I use the homemade mixture even if I take other medications? Yes, in most cases there's no problem, but always inform your doctor about any supplements or functional foods you're using. Some medications, like those for chronic gastritis, reduce B12 absorption, so your doctor may adjust doses. Question 2. How long does it take to notice memory improvement? Each body reacts differently, but many patients report subtle changes within weeks, like more energy and fewer memory lapses. More consistent improvements usually appear after 2 to 3 months of regular use. Question 3. Does this mixture replace B12 injections? The homemade version is for prevention and maintenance. If you have a severe deficiency confirmed by tests, you may need injections or specific supplements until levels normalize. Question 4. Is there a risk of overdosing? Yes, especially if you're already taking other B12 supplements. Stick to the recommendation of 1 tablespoon per day and avoid combining multiple concentrated sources without medical guidance. Question 5. Can I give this mixture to my spouse too? Absolutely. As long as there are no specific contraindications, it can be used by any adult looking to support brain health. Many couples, like Richard and Emily, adopted this routine together and report feeling more active and connected daily. Knowing these answers helps you use B12 confidently. And for even more safety, it's crucial to recognize warning signs that indicate when to see a specialist. Although homemade B12 is a great ally, it's essential to know when symptoms require immediate medical attention. Ignoring these red flags could risk your health. Rapidly worsening forgetfulness. If within months you're forgetting family names, mixing up dates, or getting lost in familiar places, don't wait. See a geriatrician or general practitioner for a detailed evaluation. Persistent neurological symptoms. Constant tingling, balance issues, frequent falls, or leg weakness may indicate more than just a nutritional deficiency. Behavioral changes. Sudden mood swings, aggression, or deep apathy shouldn't be dismissed as just aging. These could signal more complex conditions like neurodegenerative diseases. Unexplained weight loss. If forgetfulness is accompanied by weight loss without reason, It may signal intestinal absorption issues or other clinical conditions needing investigation. Use of multiple medications. If you take several daily medications, some may interfere with nutrient absorption. A doctor can adjust doses or suggest tests to ensure you're not creating new deficiencies. Remember, prevention starts at home, but an accurate diagnosis comes from a professional. Proper follow-up ensures you use all available resources, like homemade B12, safely and effectively. Now, let's talk about something very important: how your family can support you on this journey to maintain memory and brain health. Caring for memory isn't just an individual responsibility, it should involve the whole family. When children and grandchildren participate, results are more consistent and motivation grows. Talk openly about your needs. Many elderly people hesitate to admit they're forgetting things, fearing they'll seem fragile. But when you share with your family, they can help remind you of schedules, recipes, and even accompany you to appointments. Linda, 73, told me that simply talking to her daughter about daily B12 use helped her never forget to take it. Ask for help organizing routines. A family member can assist in preparing the homemade mixture, storing it correctly, or even setting visual reminders in the kitchen. This creates a sense of mutual care. Into a bonding moment. Instead of seeing B12 as a chore, make it a healthy family habit. Grandkids can help sprinkle it on meals or join in cooking. This not only helps you remember but also creates cherished memories. Explain why their support matters. When family understands that B12 and a healthy diet keep you active, present, and enjoying life, they become natural allies. They'll value time with you more and encourage your self-care. With your family by your side, every step toward a healthier mind becomes lighter and safer. And to close, I want to leave you with a special message that could change how you view your health from now on. We've reached the most important moment of this video. Caring for your memory isn't just about remembering dates or appointments, it's about preserving your independence, autonomy, and joy in actively participating in your family's life. The homemade B12 you've learned here is a simple, affordable, and powerful tool to nourish and keep your brain active. But the secret lies in consistency. Use it daily, combine it with a healthy diet, and watch how, little by little, your mind becomes clearer and sharper. Remember, the problem is serious. Millions of elderly people worldwide suffer memory loss due to B12 deficiency, often preventable. B12 is essential. It protects nerves, improves memory, and keeps the brain functioning well. Symptoms are silent. Don't ignore frequent forgetfulness, fatigue, or tingling. The solution is affordable. You now have a safe, budget-friendly recipe to use daily. Rely on your family. Children and grandchildren can help remind, prepare, and use the mixture. See a doctor when needed. If symptoms persist or worsen quickly, don't hesitate to seek professional evaluation. You can start today. Prepare your B12 mixture as taught. Sprinkle 1 tablespoon daily on meals. Organize your routine so you don't forget. Share this information with someone you love so more people benefit. I am Dr. William Tharnell, a physician specializing in elderly health, and I say with all my experience, your memory is your greatest asset. Caring for it means caring for your story and those you love. Thank you for joining me here. Take care, practice what you've learned, and live with more health, clarity, and joy.